All right. All right. Hello, my name's Nikki, and we are going to read through the Code of Ethics, and then each one of us are going to talk a little bit about which ethics number we feel is the most important and why. And who wants to start off here?
I can start off with the
Okay.
first two.
Okay.
The registered technologist acts in a professional manner, responds to patient needs, and supports colleagues and associates in providing quality patient care. The second one is the registered technologist acts to advance the principal objective of the profession to provide services to humanity with full respect for the dignity of humankind.
Mm. And then I'll read the next two.
Okay.
So, number three is the registered technologist delivers patient care and service unrestricted by the concerns of personal attributes or the nature of the disease or illness and without discrimination on the basis of race, color, creed, religion, national origin, sex, marital status, status with regard to public assistance, familial status, disability, sexual orientation, gender identity, veteran status, age, or any other legally protected basis. Number four is the registered technologist practices technology founded upon theoretical knowledge and concepts, uses equipment and accessories consistent with the purposes for which they were designed, and employs procedures and techniques appropriately.
I'm next. Number 5, the registered technologist assesses situations, exercise care, discretion, and judgment, assumes responsibility for professional decisions, and acts in the best interest of the patient. Number 6, the registered technologist acts as an agent through observation and communication to obtain pertinent information for the physician to aid in the diagnosis and treatment of the patient, and recognizes the interpretation and diagnoses are outside the scope of practice for the profession.
And then I'll read 7, 8. So number 7 is the registered technologist uses equipment and accessories, employs techniques and procedures, performs services in accordance with an accepted standard of practice, and demonstrates expertise in minimizing radiation exposure to the patient, patient, self, and other members of the healthcare team. Number 8 is registered technologist practices ethical conduct appropriate to the profession and protects the patient's right to quality radiologic technology care.
Right. Number 9 is the registered technologist respects confidence entrusted in the course of professional practice, respects the patient's right to privacy, and reveals confidential information only as required by law or to protect the welfare of the individual or the community. Number 10 is the registered technologist continually strives to improve knowledge and skills by participating in continuing education and professional activities, sharing knowledge with colleagues, and investigating new aspects of professional practice. And the last one, number 11, is the registered technologist refrains from the use of illegal drugs and or any legally controlled substances which results in the impairment of professional judgment and or ability to practice radiological technology with reasonable skill and safety to patients. All right. Who would like to go first on which one they feel like is the most important to them and why? I can.
I can go. The one, there's two that stood out.
Mhm.
Number 3, really stood out just because of like things are changing in our society. So it's more important to make sure that as a radiology technologist, we uphold that value to legally protect on the not discrimination of any kind on any patient we have,
Mhm.
which is important. And then number 7, just because of the Alora, like the Aslow's reasonably achievable for radiation exposure to anyone. So those two really stood out.
Mhm. As far as what I felt like the most important is I picked number 5, because it said in the best interest of the patient. And I was curious, just the definition of healthcare is the organized provision of medical care to individuals or a community. And I just feel like in any setting, right, we're doing x-rays or anything to take care of the patient, what's best for the patient. So I felt like that was the most important, like we're going to do whatever we need to take care of the patient in the best interest of the patient. So that is what I felt like was the most important. They're all important, so.
Yeah, for sure.
I also agree with Kylie. I don't know if I'm saying it right, the first
Yeah,
one.
you are.
With number 3, especially right now that what's going on with immigrants and all that, it just brings a lot of racism, discrimination against like minorities groups. So I thought that was something that brought my attention, especially now, and which I mean, I think the only reason a healthcare worker should deny care for that patient if it's like you are being threatened or assaulted. But if it's like a case of like religion or the sex orientation of that person, I don't think that's right. Um, I also echo that I thought that it was important for me was the number 6, uh, which is like practicing what you studied to not tell the patient your diagnosis, all that. I think that could be a big responsibility. It could it can cause fear or harm to if you accidentally tell the patient they have a tumor or something like that. So I thought that was important to know.
I actually agree with, I have the same ones as well as Kylie and Natalia. For number 3, I found it important. I mean, all of them are, but I think that, or I believe that not anything should impair you to do your job. It's our job to help any patient, regardless of any belief, sex, identity. We don't get to pick and choose who we want to help. I think we take an oath as radiologists to help any patient, regardless of any status, any orientation. And I think it is important that it's emphasized, as Kylie said. There's a lot of change going on in society. And I think even more now, patients need to feel that they are welcomed and they're going to be cared for. I think if it wasn't emphasized as an ethical code, I think our system would probably fail if we only got to pick and choose who we only wanted to help. And I also truly believe in it because this is one of the reasons why I am pursuing a career in the medical field. I truly believe in helping anyone, regardless of any choice, or I may not agree with their belief with what they're doing, but it's not my responsibility to judge anyone. For instance, I worked at RadNet, it's an imaging center, and I didn't know this, but a lot of patients will come in from jail. So you still have to help them regardless of anything they might have done, which is any murder or anything. We still have to do our job. It's not our responsibility to judge what you did. It's just our job to help them. I also think number 6 was important because I feel like we have to understand that we have a boundary as a radiologist and a limitation between what we can and can't do. And one of them is that we shouldn't be diagnosing. We're not licensed. We're not a physician. Even if we think we may know what's going on, I feel like we can instill more fear in a patient if we're kind of hinting at, oh, I think there may be something wrong here, but we could be instilling more fear because there is a lot of patients that are already coming in because they are scared. Maybe there's a foreign body, there's a lump, and there's a lot of things that go behind that, like getting a biopsy to confirm that it is cancerous. So I think we have to keep a clear boundary of what we can and can't do and respect that we are a radiologist, we're not a physician to diagnose a patient.
Yeah, absolutely.
Going off of everyone, I also said, well, I specifically wanted to touch on number 2, kind of touches on number 3 as well. Kind of this idea that the patients that we deal with are human beings with emotions. And a lot of the times, they're like their most vulnerable, especially in healthcare. A lot of people don't want to be there or they're scared. So it's not just about us like doing scans and then that's it. It's like we have to remember that these are real humans with real lives and we should carry out like every procedure with respect and compassion. Um, like they're not just like another patient coming in for a scan, they're like real humans with real emotions. And also, I number 10 stood out for me, which is to like improve your knowledge and continuing education, especially since I feel like healthcare is constantly growing and changing. And I think, especially in radiology, with the technology we use, it's going to keep changing. So it's important for us to keep on top of that so that we're providing the most accurate and like the safest care possible when we're with our patients. And as I've heard, education doesn't just stop with a certification. It's like you keep
Sorry.
learning.
Sorry.
And yeah, that's pretty much it.
Yeah.
That's completely true, Kaylee. Because I think sometimes we may think that we know majority, but every patient's going to be different, or somebody else might come in with something we don't know how to do. And I also think it's our job to advocate and ask for help if we don't know how to do the procedure. So I think that's completely valid.
I think you guys all made good points. Yeah. Is there anything else anyone wants to say? We're good. All right, I'm going to stop recording.